Hello everyone, today is December the 3rd. I'm Dr. Adam London, Director of the Kent County Health Department. Right now we're reporting 32,870 cases of COVID-19 in total this year. Yesterday we saw an increase of 563 new cases, and that's been our average for about the last week. So we have seen our new cases level off a little bit over the course of the past week. That's a good sign, but I do also worry that it's a little bit of a mirage. A mirage because testing is down a little bit, both because testing supplies have been in short supply recently, and also because of the holiday, fewer people came in to get tested. I'm also concerned that the Thanksgiving holiday itself, with all the gatherings that we know happened, is going to add more fuel to this pandemic. So we're going to watch our numbers very carefully in the coming weeks. We're still very concerned about where things are going as we approach Christmas and New Year's. Our positivity rate staying about the same, right around 15%, and we continue to see about 6 new deaths every day. Our hearts and prayers go out to all those families who've been personally affected by this outbreak. These numbers are still way too high. So many people have made the case that it would be easier and perhaps even more humane to use a natural herd immunity approach to overcome the COVID-19 pandemic. An approach like that would provide focused protection towards vulnerable people and allow, maybe even encourage younger and healthier people to live their lives as normal, perhaps even unmasked. The proponents of this approach believe that by doing this, the virus would spread easily amongst people who are lower risk for severe symptoms, and that those people would then have immunity to the virus. As a result, we could possibly reach a point where a majority of the population would have naturally acquired immunity while preventing the most vulnerable from being exposed at all. The proponents of this approach make many accurate statements, and I believe their intentions are absolutely sincere. And I do agree that this sort of approach makes a lot of sense on paper or in a highly controlled setting. The problem with this approach, however, is that it fails to consider some key variables, and it falls apart in a real-world American environment. And here's why. First of all, when proponents of this approach talk about focused protection, they are generally talking about people with underlying health conditions and people over the age of 70. About 1 out of every 20 people in this group do not survive a COVID-19 illness. The problem with this approach is that it's not possible to fully insulate one part of the population from all others. Older persons and people with health challenges are also active members of our community. And in many cases, they live alongside younger and healthier people. Think of all the complaints people have had this year, founded and unfounded, about violations of their constitutional rights. Can you imagine the uproar if, as a society, we were to tell older people and people with underlying health conditions that they have to remain in their bubbles until the pandemic is over? It just wouldn't work in a free society. And anything short of that sort of complete isolation would quickly overwhelm the hospitals. Secondly, the focused protection approach fails to appreciate how many people actually have underlying health conditions, which do make them vulnerable to more severe illness. According to the CDC and other sources, greater than 40% of the American population would qualify because those conditions include things as broad as diabetes, hypertension, obesity, heart disease, asthma, cancer, and many others. Furthermore, not everyone who has a serious underlying health condition is aware that they have that condition. And finally, no one fully understands the long-term impacts associated with COVID-19 and who is truly most vulnerable. We've gone from thinking that this was just an illness of the respiratory system with simple symptoms such as cough, fever, and difficulty breathing, to recognizing that COVID-19 is also linked to myocarditis, multi-system inflammatory syndrome, and a group that has become known as long haulers because of the persistent challenges they face long after their infections have passed. COVID-19 is far more complex than anyone originally understood. Our public health strategies should do the very best that we can to provide protection for all people and to acquire herd immunity through the safest route possible, vaccinations. And that's why I look forward to sharing much more with you in the coming weeks about vaccine and our plans for making it available to all the people in Kent County. Until next time, please continue to stay positive, stay heroic, and stay healthy. Thank you.